If you've had back surgery or you're considering back surgery, here's something that most people are not told. Even if the surgery goes exactly as planned, you may still have pain afterwards. Here's why. So, surgeons do incredible work decompressing a nerve, cleaning up a disc herniation, or stabilizing a spinal segment. Just amazing things that they can do. The problem is the spine is complicated, and the surgeon may do exactly what he or she says they're going to do, and there's still pain afterwards. So the pain could be coming from somewhere else. Pain is also related to poor movement patterns, poor muscle control, poor muscle endurance, inflammation, all sorts of things that the surgery does not address. So let's take a spinal fusion, for example. So two vertebrae are fused together to control and stabilize. Okay, that's good. The problem is that movement that you lost at that segment has to be made up somewhere else. So you end up getting increased motion above and below that section that's fused. And so you end up getting faster degeneration of the segment above and below. Okay, it's called adjacent segment disease. I'm not making this up. It's documented, and surgeons know about it as well. So getting a fusion is not an automatic fix if you don't change the way that you move. Okay, similar situation with a discectomy. If someone has a disc herniation and they get surgery to clean up the part of the disc that has herniated, that's wonderful. It probably relieves pain. Here's the problem: it does not fix the disc. Okay, it removed the herniated portion, the portion that had leaked out, but it doesn't repair the disc. So the disc is still vulnerable. And actually, 12 to 25% of people who have a discectomy reherniate their disc later on. So again, this is documented. It's a common problem. And so again, without changing movement patterns, without addressing muscular control, the surgery is just a short-term fix like anything else. And a similar situation again with surgeries that basically clean up bone spurs. Surgeon goes in, cleans up the bone spurs. That's wonderful. It may provide relief initially, but if the patient hasn't learned how to move in a way that spares their spine stress, then that spine is going to break down again, and it's going to form more bone spurs again because of poor movement patterns, poor body mechanics. So again, it's a short-term fix. You have to learn to control your spine and adjust the way that you move. Another factor that folks don't consider is lots of times by the time you've had surgery, you've been in so much pain that you've limited your movement and you've developed a lot of weakness. And after your surgery, that strength doesn't just come back on its own. You've lost that strength, and the surgery does not give you that strength back. So you have to regain that strength, that neuromuscular control. That's how you protect your spine. So that's why if someone has to have surgery, doing strengthening before and after is crucial. In my opinion, surgery without some sort of strengthening before and after is madness, because you're going to be weaker after the surgery, and you have to take steps to protect your spine. Here's another factor to consider. With the exception of cases of trauma, car accident, a fall, something major that happened to cause a specific injury, aside from those cases, um, the spine doesn't just degenerate in one spot. Okay, it's usually a global degeneration, degenerative changes up and down the spine, and that spot where someone gets surgery is just the space where it was degenerating the quickest, that looked the worst, but that doesn't fix the big picture problem. The big picture problem is that entire spine is degenerating in multiple spots, and that surgery just addressed the worst spot. And that's why you often see folks going back for a second surgery and a third surgery. Is it's rare for the spine to degenerate in one spot. It's usually up and down the spine. And so it's an endless game of surgeries if you're going to replace or repair each section one at a time. So, does that mean that surgery is bad? Absolutely not. There are cases where surgery is absolutely appropriate. So, whether you're trying to avoid surgery or you've had surgery, take a look at my free mini course. It's 4 back saving techniques for the degenerative spine, spinal stenosis, degenerative disc disease, chronic back pain. It's free. It's a good starting point to help you learn to control your spine. Check it out in the show notes. And I appreciate you watching today.